Hello.
Hi.
Hi. How are you?
Good, and you?
I can't see each. So EC. It says EC.
With video.
Record. Oh, start videos. Oh, I'm out.
Okay.
And our camera sucks.
Hi, Nikki. Hi, Nikki. Okay, how come I don't hear nobody? Are you speaking? Yeah, we have a few more minutes before everybody else. I think it starts at 1. But
Not working.
hold on, let me
Getting
make
in my email. But it's not working. You remember my email?
You don't.
I'm putting it in. Literally putting it in.
That's good. You don't make I don't know. That's like a different things.
Or I can literally just go and
hello, 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 everyone. Let's see. We are going to, I'm actually waiting for Dr. Iyabo to come on. As soon as she comes on, we are going to start.
So you'll be listening. Brother, where you go? Come and join him. Excuse me. Go and join him. What you should listen.
Hi, Heather.
Hey, how are you doing? Good to see you.
Good to see you. I am well.
Excellent. You look lovely. I've got Sophia and Julia. They're both going to hop on, and they got some friends involved too.
Oh, that's good. I haven't seen Sophia and Julia for I don't know how long.
It has been fun. Come here, Sophie, please.
I'm so excited to join.
Okay, she's telling her friend to hop on now.
Okay.
Sophie,
Hi.
remember
How
to
are
say
you? Oh my gosh. They're so grown. Do you remember me making kombucha with your mom in your kitchen?
Yes. I'm gonna go get you.
Okay, we're gonna get her sister. Hang on one second.
Okay, no problem.
Okay, we're excited about this. Hop in. Okay, Julia, come
Now
in.
don't grab my
Shh,
wrist.
guys, we're the only ones making noise. Julia, come in. And there's my Julia. You say
Hey
hi?
guys.
Hello.
How are you?
Good.
Hello. You say hello?
Hi.
Uh-oh.
We're going to give 2 more minutes.
Come this
Let's
way.
see. 2 more minutes
Okay.
for Dr. Iyabo to join, and then we are going to start.
Okay. You say hello?
And everybody can unmute for now, so we can all say hello. And then when we start, you all would mute yourself.
Okay.
Yes. How old is your baby?
I can listen. No.
I
Hello?
see the cute little guy right there.
Okay, I can hear. Yeah, it's working now.
How old is he?
Who, the baby?
Yeah.
Oh, he's gonna be a year next week, July 4th.
Oh, wow. You have your hands full.
He's gonna be 1 year, July 4th. Oh yeah.
You decided to have a baby 4th of July, huh?
No, he came that day. He decided to come that day.
Oh my gosh, that's good. So Dr. Iyabo says she is jumping in 1 minute. As soon as she jumps in, we're going to start. I would have one of the kids volunteer to say a prayer, a quick prayer, and then we will get on with it. Who is going to pray? Has to be a kid though. Yeah. So we already, that's fantastic. How old are you?
Who is she talking to?
You talking to Julia?
I am talking to Indoni or so. What's your daughter's name? Are you on mute?
Soledad.
Soledad. Thank you for offering to pray. Dr. Iyabo is here. So Soledad, you are going to lead us in a quick prayer. Okay?
Which prayer?
Well, you will have to make up the prayer.
Okay. So I can start?
No, you have to wait.
Okay.
Yeah. And everybody else, if everybody else can just mute. But for Soledad who is going to pray, I would appreciate it.
Okay, so thank you, God, for keeping everybody safe. Okay, in the Father and the Son, Holy Spirit, amen. Dear God, thank you for keeping everybody safe for COVID-19, and whoever is sick out there, I hope they get better. And also people who are homeless, I wish some people, I wish they feel better. And also thank you, God, for keeping everybody safe at home, and I hope and we can all go back to school. In the Father, and the Son, Holy Spirit. Amen.
Amen. Thank you so much, Soledad. That was a beautiful prayer. So Dr. Iyabo is here. I just want to take a quick moment to welcome everyone to this one of many down the road. We decided, Dr. Iyabo and I, that this is something that's so important to really try and get our children healthy, to get our children avoid some of the diseases that she sees day in and day out in her practice, which I'm going to let her speak to it. But thank you guys so much for really making the time to sign up and bring your kids on board, because our kids are the future. And sometimes I know as parents, it's really hard to really do all the amazing things that we're doing and go to the nitty-gritty of making sure that the kids are eating what they're supposed to be eating, doing what they're supposed to be doing to stay healthy. So my hope is that down the road, our influence is going to help. So I am going to pass this on to Dr. Iyabo. She would introduce herself and she would talk from this space of a seasoned pediatrician. So Dr. Iyabo, I'll let you take it from here.
Hello, everyone, and my apologies for logging on late. Just how time just, I just lost the, what's it called of time. So I'm so sorry, my apologies. It's wonderful to see everybody today. Can you all hear me okay?
Yes.
You can? Okay, very good. And if everybody else can mute, just so that we don't have any background noise, that would be wonderful. So like my friend Agatha said, my name is Dr. Iyabo Webzell. I'm a pediatrician, a board certified pediatrician. I've been practicing for the last 28 years. And obviously my passion is children anywhere from 0 to 21. People don't realize that pediatrics actually goes that far. People think, oh, when they're 15, do they leave your practice? I still have some 20-year-olds that I don't want to go anywhere because I've been seeing them for so long. So we have that long opportunity to be able to inspire and educate our kids with very good skills and good habits that they can take when they leave home. Even though, you know, in the African culture, kids never leave home. I remember when my parents were alive, I still felt like a kid because my dad would still call me every Sunday. I still felt like I was still under his care. But when we do, you know, let our kids go and we say, okay, start going to live your own adult life, we want to be confident that as parents, we've really inculcated in them the best habits that we could. All we can do is try our best, and we hope that our kids will take up those habits. So I'm a pediatrician. I'm also a speaker. I'm a blogger. I blog about everything that has to do with life fulfillment and happiness and peace and joy. I'm also on board of the biggest women's app. It's called Flow MD, yeah. And I've spoken at the United Nations a few times as well. And Agatha and I came together because we just felt that a pediatrician and an experienced integrative nutritionist is what we need. Because when I'm seeing patients in my office and I'm talking to them about obesity and overweight, I always wished that I would have a nutritionist beside me. But everybody on here knows about all the barriers we face with insurance and non-payment of our services. It's funny that in today's world, and if there's any doctors on, you can confirm with me, in today's world, we don't get paid for counseling our kids about obesity and nutrition and overweight. We don't. Anytime we bill for it, they just bundle it up with other services and we get paid zero. So of course, that's not going to help physicians even want to do it, but I still do it. I spend my you know, all my minutes trying to talk to them, but I find it's never effective. They come back to me after 1 year, they've gained 15, 20 pounds, you know. You see a 10-year-old who is like 150 pounds, and it breaks my heart. I'm like, what am I doing? Is my work even being effective? So I feel that social media, now Zoom, has given us the gift of communication, that we can now come together and deliver to so many people in one setting. Look at us now. I think we have about 20 participants here. That is each individual login, and there's kids also on here. So kids, we want to make sure that you're healthy. Myself and Auntie Agatha, like we say, right, we're both your aunties. So Auntie Iyabo and Auntie Agatha want to make sure you're healthy. They want to help you and mommy and daddy so that you can choose healthy meals. Because if you're healthy and strong, guess what's going to happen? As you grow up, you're going to be able to fulfill all the things you want to do. If you want to be an artist or a doctor or pharmacist, or you want to go to dancing school, whatever it is your passion is, if you're not healthy, you're not going to be able to fulfill those passions. So kids, we want to help you. And then you have to help each other. If there's some big kids on here, if there's big kids above the age of 10, if you have little kids who are like 6 or 7, then you can help them and show them what to eat. So having said all that, of course, there's many illnesses that we see in pediatrics, many, but there's some that are part of the top 10. And I want to talk about obesity and overweight first, because that's an epidemic now in the States. And unfortunately, as Black people, and I'm a Black woman, I can say this to you without you feeling that I'm pointing fingers. I really want us as Black people to humble ourselves and to really listen to what health professionals and other professionals tell us. I think the first problem is, if you don't identify that you have a problem, you won't step out to fix it. So I've noticed that in all my years of practice. That's why I stepped away from clinical medicine a bit. I still have my practice that I manage, but I'm doing more of what I'm doing now. I'm doing more of social media speaking. I'm doing more of outreach out in the community, because I feel that's where I'm going to have the greatest impacts for people's total wellness. Sitting under the ceiling of my office and having 10, 15 minutes to see a patient like a robot hasn't given me much impact. I have bigger dreams than that. So, but the one thing that I've noticed is, parents, please, if you don't mind, really paying attention to this one thing. Even if you don't hear anything else that I say, please let us not be in denial anymore. I think there's too much denial out there with our own health and with our children's health. We get very defensive whenever professionals are telling us about what they feel is going on with our lives. We get defensive, we want to deny it, we want to decline it, and it doesn't help us, and our problems just keep getting worse. So please be humble, listen to what your doctors say, take their advice and practice it, and be consistent. There's nothing in life that happens overnight. You have to be humble, and then you have to practice consistency. So obesity and overweight is a very difficult problem to treat, because I wish I could move into every home. I say when I get home at night and I'm journaling, I'm like, I wish I could pack my suitcase and go and live in every home for a few days and clean out their pantry. Because I tell them that, I'm like, when you get home, mom, clean out your pantry, clean out your fridge, throw all that junk away. But I know most families probably don't do that. I feel like I want to move in with them and clear it out for them. But obesity is if your child's body mass index is on the 95th percentile or higher. I know I'm going a little bit into medical terms now, but I want you to understand the standard things we use. I didn't just make it up. I feel like some patients think that doctors just make these things up and they guess like, oh, you look obese, oh, you look overweight. No. The CDC has done its due diligence, and they have growth charts that help us. Agatha, how am I doing with time? Because sometimes I just keep rambling on. Okay, so, and then overweight is, okay, thank you. And overweight is body mass index between the 85th to the 94th percentile. That's overweight. Both of them are problematic. Because once you get into the overweight range, you sleep, you wake up, you're in the obesity range. It's very easy. So if your doctor tells you that your child is in the overweight range or in the obesity range, it's time for action. But to even avoid getting into those two categories, it's best to prevent getting there. And it's very easy to try not to get there by what Agatha and I are going to start today to help you model all this. So the number one illness, and I call it an illness, not because of vanity. That's another thing. People always think when we talk about obesity and overweight, we're indirectly saying they don't look good. No, there are many beautiful people that are obese. Beauty comes from within. You can be the most beautiful person on the face, but you have a terrible inside. You're not kind, you're not respectful. So beauty is from within. So when I'm talking to my patients about obesity, the first thing I say is, do you know how beautiful you are? And I don't say that to patronize them. I say it because for me, beauty is about the gifts we have from God. It's not about all this. Yes, I put my makeup on and my lipstick, but first thing in the morning, I don't look like this, guys. So yeah, I don't look like this. So beauty is from within. So remember, it's not about vanity. If your doctor tells your child that they're overweight, they're not telling them that they're not attractive. They just want them to be healthy. So obesity and overweight lead to all sorts of problems. We all know what they are, and I'm not going to go into it too much. Type 2 diabetes, heart disease, high blood pressure, gallbladder disease, strokes, heart attacks, low self-esteem, depression, sadness. Let's not forget those. It's easy to say type 2 diabetes and strokes and heart disease, but there's a big number of these kids that are so sad, they're depressed. Some of them even have suicidal ideations because they get teased all the time. They don't like the way they look. They lack self-confidence. So let's not forget the mental health burdens that we have with that. That's number one. Number two, I'm sure are there any 5-year-olds here? Are there any 5-year-olds? Can you say yes on the chat? Can the moms tap? Are there any 5 and 6-year-olds? I think I see some really young faces, no? No 5 or 6-year-olds. Any 7 or 8-year-olds? Do you know how to type on the chat? Yes. Oh yeah, I see somebody. Okay. And I'm not going to ask you if you've had any illness before because we want all this to be confidential. But ear infections are very common. Okay, thank you. Ear infections are very common in the younger age groups. We don't have the 2 and 3-year-olds on here. I know we're talking to 5 and above, but ear infections are very common in the younger age group. I'll say from about 6 and downwards, because that age group, they're the ones that still go to daycare. And well, there's a lot of common colds that go on, and ear infections start from the nose first. So you have a cold, you have mucus in the nose, and then it goes into the middle ear and causes infections. So ear infections are very, very common. And then sometimes it leads to surgery. Kids have to get tubes in their ears. Some of these kids also have hearing loss. So ear infection is not just some simple infection we just talk about. It has its own consequences. So ear infections can lead to hearing loss, and then that can lead to speech delay. So it's not to be taken lightly. So that's another really common one. The third one I've kind of talked about, what we call common colds. Oh, I have a cold, I'm sneezing, I'm coughing, my nose is running, I have a little temperature. All those runny noses. You walk into a daycare and almost every kid has like mucus in their noses. So common colds are also very common. And then the fourth one I want to talk about actually is extremely common. It's the fourth one, but it has 3 conditions as part of it. We call it the allergic triad. It's the combination of 3 conditions: asthma, allergies, like to the pollen. I have really bad allergies. I'm always sneezing and itchy eyes and all that. So allergies, asthma, and eczema, that dry, itchy skin. Some people, I'm pretty sure somebody, please don't tell me who, we have to keep confidence in this conference. We don't want to make anybody feel like they're sharing their personal information. But I'm sure somebody I said I have allergies. I'm sure some kids on here have one of those three: asthma, hay fever, which is pollen allergy, or eczema. It's so common. And you'll be surprised. I was looking up some studies before this Zoom conference. You'll be surprised how the food we eat influences all of these conditions. I know how I feel if I start eating my cakes and ice cream and chocolate and I forget to eat well. I know how I feel in my body, and then I quickly reset myself and go back to my fruits and veggies and my healthy eating. So everything we eat also determines how we feel. And this is why Agatha and I are here today to help you out with this. So that's my part. That's my pediatric part. I'm going to send it over to Agatha. I'm sure I'll be back later, but Agatha is now going to take all these common conditions and tell you what you have to put in your body to help you prevent all these ailments. Thank you, everyone.
Thank you, Dr. Iyabo. And again, my name is Agatha Achindu. The most important thing about sickness, especially the four diseases that Dr. Iyabo has mentioned, is that we as the children, we as the adult can do something about it with food. There is an immediacy that food can correct. And it is the reason why I and Dr. Iyabo are here today, why we asked that the kids are here, because I know some of you are like, okay, why am I coming there, Mom? Why am I here? Because we know that when you get this information, when you know that, oh, if I eat this way, I am not going to be sick to get shots when I go to the doctor, you would even start trying to help your parents when they forget. Because yes, parents, we sometimes do forget. And sometimes we don't know enough. So we don't have enough time to cover every little detail. But the good news is this 1 hour that we are going to use to spark your curiosity, that you can come back later if you need more. But we start with something. I'm going to start with something as simple as obesity and as complex as obesity. And I use the word simple and complex because it's almost one and the same thing. When I heard Dr. Iyabo say she sees a patient, the next year when the patient comes, the patient has 15 pounds more. So today I'm going to just talk to the kids. A few things that you can do at home that can really help you if you have weight issues, even if you don't have weight issues today. When we eat healthy, it's for everybody, whether you're slim or you're obese. But today we focus on obesity. What are the things, some of the simple things that you can do at home? The first thing that I see with a lot of children, it's soda, which is just pure sugar, it's empty calories. That is something that you taking that soda drink out of your everyday life is going to make a huge difference in your life. And this doesn't change anything, because then you can still drink, you can drink water at home. You can make your own fizzy water. You and your siblings and your parents can make fizzy water. And this goes to you, the kids, if you see today that you know, if you see your parents trying to drink soda, especially every day, you need to step up. Mom, I love you. Dad, I love you. You need to stop drinking soda, because soda doesn't only cause us to put on weight. Soda, this processed, overly refined sugar, compromises our immune system in such a way that it makes us susceptible. It makes us easy for us to catch something like cancer. So all these things, that's just from soda every day, right? Try and eat vegetables. I know kids, you hear your parents tell you all the time, eat your veggies. Veggies are not optional. Not saying don't eat the other things you want to eat, but make sure that every lunch and dinner, when you sit to eat, if you look at your plates, you have more vegetables, and you can choose whichever vegetables you like. Broccoli, carrot, zucchini, lettuce, they are as many vegetables as the sun, as the stars, if you ask me. So the food you eat really impacts. And then there is something, again, a lot of you kids love to eat bread, and you don't like eating whole wheat bread. If you are going to eat bread, it is important that you eat the whole wheat bread, because if you're eating the wheat that's been so refined, it makes you sick because your body digested it turns to simple sugar. So once in a while, when you're having a special treat like cakes, that's fine. You can use the airy refined sugar flour that doesn't have any nutrients. But because you eat bread almost every day, you eat wheat every day. If you think that in the morning you have pancakes and at lunch you have a sandwich, that's actually having bread twice a day. So you need to tell your parents that, oh, I want bread from 100% whole wheat flour, and look at the label. It's important that you look at the label so you know what you're eating. So bread, and the reason I'm bringing bread is because it's something, whole wheat is one of the most consumed foods in America. It's everywhere. So you look at that, you look at reducing sugar from soda, that's another important one. And fruits, you try to eat as much fruits, and you help your parents. When your parents are going to the grocery stores or to the farmer's market, you remind them to bring fruits, fresh fruits, especially during the summer when a lot of fruits are in season. Not the fruit that's been cooked and put in sugar containers, no. Just fresh fruit, banana, whatever fruit that's even on sale, that's affordable. It's good for you. That's another thing. You want to make sure you are exercising. Take your parents out for a walk. Take them out. Tell them you need to get out. This is summertime, and COVID has made it so almost impossible because we are at home. We can do the summer camps and all the fun things that normally you would do. But make it a point every day, if you can, that you guys go for a walk outside. You don't have to go to crowded area because, again, we're trying to just get this COVID thing to go away. But go out and walk and run. It really does help. Physical activity really does help. And sleep. Sleep is another important factor. I know in the summer you all want to stay up late and play the games. You need to make sure, and this is something that I would let Dr. Iyabo at the end come back and touch on a little bit. How many hours of sleep you guys are supposed to have, that you need to really put in sleep. And when you go out, you get the vitamin D. It's important. Your portion, when you eat, make sure that you're looking at the portion that you're eating. Are you eating so much food that you can't even walk? That's something to consider. And all these things that I'm talking about, it's not just the fact that, oh, you are obese, you're going to put on weight. No, we come back to, I go to ear infection, right? When the immune system is compromised, then all these other little things become bigger things, because our immune system is our #1 defense. So whether you are small or you are a bit obese or you're obese, healthy eating is paramount for us all, because it's the one thing that helps us fight off diseases when they come. When you go to school and everybody's having runny noses, your immune system It's what's going to make you, when you get that cold, it doesn't paralyze you. It doesn't last for 1 week. The cold comes and goes. Everybody who is watching the news lately, you hear them talk about, oh, we need our immune system because there is no cure at this point for COVID-19, or there is no vaccine, because I don't even hear anybody talking about cure a lot, unlike vaccine, which means we're going to be maintaining it. So you want to make sure that nutrition stays paramount. Help your parents cook at home, because when you cook at home, you can really try and avoid some of those synthetic ingredients that's in a lot of packaged foods that you eat. So when you cook at home, even when there is not a lot of money, the one thing that you can count when you make your food at home is that it has more nutrition, more nutrients than what you're going to buy from the store. That is something that you have to try and get your parents. I know life is hectic, everybody is busy, but you can tell your parents that you can pick one day out of the week to cook some, it might be 2 or 3 things that you can keep in the freezer, and during the week you can eat. So then your parents don't feel overwhelmed with trying to take care of you guys and then also trying to do their job, right? So sugary drinks, whole wheat instead of overly processed at something, making sure you're eating enough vegetables. At my home, vegetable is not an option. It's something that we do every day, because especially in the summer when it's so hot, when you are eating fresh veggies, it's just like the best thing. Some of you, I know you don't like veggies. Just as I mentioned earlier, there is enough varieties for you to find a vegetable that you like, right? So that's an important point. And then snack. There is a huge difference between a snack and a treat. So a treat would be cookies, right? Candies, this type of fun stuff. Those are treats. A snack, it's something that you can eat every day, because it's just that it's the meal that holds you in between mealtime, the little food that will hold you in between mealtime. So you don't want to, every day when you're asking for a snack from your parents, you don't want to be eating cookies. You don't want candies. And if you ask for a snack, your parent hands you an oatmeal cookie on Monday, and on Tuesday hands you another cookie, you should be able to say, no, this is not good. My body can't strive fully on this type of food. I need for a snack, it might be some homemade chips, it might be some fruits, right? Just try and understand the difference. And again, we don't have enough time to really break down into a lot of these things, but this is a series. So hopefully, if you need more, the next time you can come, and then we can really model this from meal planning and all those things, what to avoid. I have a few more minutes, then I'm going to hand it to Dr. Iyabo, because I would like for her to talk about sleep, because during this summertime, a lot of you, I know you fight with your parents all the time. I want you to hear from your pediatrician how important sleep is and how much sleep you need every day for you to be able to strive fully, because lack of sleep does affect your immune system, because it causes inflammation in the body, and everything that affects your immune system eventually leads to you being sick, because that's where we come back. So Dr. Iyabo, I am going to pass this to you for, it might be 5 minutes, and then I will finish, then we can do some questions.
Okay, sleep is very important. Very, very important for all of us from 0 to 110 years old. I personally and my husband's also on here, my stepsons. I have 2 stepsons, they're 6 and 8. But personally, for me, if I don't sleep well, my day doesn't go well. It just doesn't. I'm not able to exercise. I'm not able to read well. I'm not able to want to go out for a walk. So sleep is very, very important. And I have a 16-year-old also in the house who likes to go to bed very late and wake up late. But the sleep, on this conference today, we have kids between the ages of 5 to 16. And the range of required sleep, the number of hours that age group needs is from 9 to 12 hours. So obviously, the younger you are, the more sleep you need. So if you're a 5-year-old, you need probably more like 11 to 12 hours sleep. If you're 16, then maybe you need about 9 hours sleep. I'll say 8 hours would be the minimum if you're 15 or 16. Anything less than 8 hours is not optimal. So I hope everybody got that. For the sake of this presentation, we have kids 5 to 16. For that age group, 9 to 12 hours. And parents, please be careful of screen time. And I hope we all know what screen time is. Screen time is looking at any device. Right now, we're all looking at devices. So honestly, once we're all done with looking at this device, according to the AAP, I didn't make those rules. So I always back it up with evidence-based data. So the American Academy of Pediatrics says that kids should only look at any screen for a maximum of 2 hours a day. And screens also include TV. So iPads, iPhones, anythings, Androids, TV, 2 hours a day. There's so much and even the handheld games. Thank you, Agatha. And handheld, anything that you're staring into a screen, 2 hours maximum a day. Kids are not going to sleep because they're always on their screens. They're not going outside to exercise, like Agatha said. They're not getting fresh air or vitamin D. We all need vitamin D. We have an epidemic of vitamin D deficiency now in the whole world. And vitamin D is also needed for immune system. So if you have low vitamin D, it affects all your systems. So go outside, get some sunshine, run around, and drop the screens. So I hope I was able to talk about sleep. Sleep is super important, guys. And if you don't sleep well, you're also more likely to want to snack on all those high sugar cookies and treats. If you sleep well, then your body feels stronger. Thanks, Agatha.
You're welcome. Thank you so much for putting that. I know that was an important piece. And I would go back. I know one thing that we don't talk about enough is junk food. Junk food is almost as worse as you being hungry. And the reason is because you eat some of this food, even though your body, even though you feel full, your body is still hungry. Because
ask everybody to mute. Somebody's device, somebody hasn't muted, so we can't hear you well.
Okay, hold on. Let me go to the next screen. I just make sure. All right, I think I saw, it looks like somebody was trying to call in with a phone. So I just muted them. I'm not sure. But with junk food, all of this fast food, you have to make sure, again, this, I'm putting it in your hands, the kids. If your parent is so busy on Monday and they're like, oh, let's stop by and get junk food. And on Tuesday, the same thing, you need to step up and say, Ma, Papa, please, I can't eat this food every day, because down the road, even though I'm not sick today, I'm going to get sick, because this food has very little nutrients. It has way too much of the bad stuff in it, from the bad oils, synthetic ingredients, all the things that makes our body sick is in a lot of this fast food. Because again, they are trying to make their money, which makes sense. So, but you have to just be mindful where you put your money. So remind your parents, I would ask that you guys treat fast food like you treat the treats, the once in a while type of thing. If you just can't give it up, then it might be once a month. You can go there and have it. The problem, everything that you're doing all the time, the things that you do the majority of the time, that's where the problem lies. That's where sickness. It's not the once in a while that you go and, oh, it's my birthday and we're going to have ice cream. You should enjoy that. That's not the problem. It's the things you do, the things you eat every day. That's where you have the biggest challenge. So we are now at 1:43 and there are a ton of questions. So I would ask, if you have questions, please just type them in the chat, because since we don't have so much time, we want to make sure that we address a couple of theirs. And then again, when we go down the road and we have an event and you think it's useful, this would be the time that we would have more hours. It might be 2 hours, it might be 3 hours, depending on what it is that we're trying to cover. But please just type your questions in the chat.
Yes, so Agatha, I'm going to go ahead and answer Yewande's question, if that's okay with you. Yewande, you asked about screen time. So Yewande says screen time pre-COVID was easier, but now for my sanity, I hear you. And while working from home, it's hard. I hear you, you're right, but there's so many other activities. Yewande, again, I don't know what age group you're in, but obviously you're an adult. We didn't have screen time when we were back home. I tell my husband all the time, if I wasn't studying for school or for an exam growing up in Nigeria, I was outside playing. I was either in my room studying, or I was outside playing hopscotch, jump rope, playing with we didn't even have any fancy games or drawing. I would just take a paper and start drawing. For sure, you can think of a lot of other activities that the kids can do without needing your input. I understand that you work from home, but you can get them all sorts of games. They can play with Legos. They can do some artwork. They can read books. Reading, we haven't even talked about that. Reading. Kids don't read anymore. Agatha, what are we going to do? We need to talk about this on another conference.
I know. That would on another conference. There is a question here from...
So I hope I answered your question, Yewande. Just try and think of other activities. I'm sure I can send you some options, some ideas if you would like. You can message me on Instagram.
Okay, we'll do so. I think can you hear me?
Yes, I can hear you. I want to respond to the question that you just put there about that you give the kids yogurt and Danimals. And I'm really happy that you brought this up. I tell people that yogurt is one of those healthy food that in America today, which America is everywhere now, is made so unhealthy. Because when you look at a lot of yogurt, especially the flavored yogurt, some of them have more sugar than you would see in a cookie. And the problem, why this is such a huge problem, is because this is something that when you bring home, you know you're bringing healthy food. I mean, yogurt is food that is introduced to babies from 6 months. And some of those organic yogurt has 4 teaspoons of sugar in it. So I would say this is my advice to you. If you are doing yogurt for the kids, not everybody can make their own yogurt, fine. Buy plain yogurt. Never buy flavored yogurt. Buy plain yogurt and then you flavor the yogurt at home. This gives you so much control of how much sugar. You would be surprised how much a teaspoon of raw honey or even sugar tastes. It makes you wonder why 4 teaspoons of sugar would go in anything, especially for kids. So buy plain yogurt, and then you put honey. You can cook, you can make your fruit puree at home. You can make applesauce and add in it. You can chop fruits, but there's so many ways that you can sweeten your yogurt at home. If you want to do it every day, sweeten it at home.
Thank you.
You're welcome. Okay, so Sophia wants to know, Dr. Iyabo, are you seeing these questions as well? Okay, so Sophia wants to know what I'm drinking. This is infused water, and it has mint that we have in our backyard, cucumber, a little bit of lemon. I didn't have a lot, so I just used the little that I had. And I added 2 strawberries I sliced.
You too.
That were so old. They were too much. I cut it and put in there. So that's the trick, is infused water. I do 0, when I say 0 soda, that's me. I don't do soda at all, but I drink a lot of water. Somebody asked, actually, oh, that's interesting. How many servings of fruits and vegetables do you have to eat a day? I say 5, but I want Dr. Iyabo to answer this question, please.
That question, do you know what I tell patients when they ask me that? I tell them 10 servings. I exaggerate it. Because yes, it's 5 to 6. It's 5 to 6, but I say 10 because I know if I say 10, they'll probably end up eating 1 apple or 1 banana. Right? So I'd rather them overeat fruits and veggies than go and be eating McDonald's every day. So the answer is 10. If you want to eat 1 apple now, then half a cup of blueberries in another hour, then a banana in 2 hours, go for it. I would prefer you doing that than drinking soda. So really the recommended portion is 5 to 6. But if you're feeling like eating 10, go for it, as long as you're not overdoing it.
So there is a question from one of our moms here that her child, who is on a vegetarian diet, has elevated cholesterol. So I'm not calling names, I'm just talking about this. That she makes a lot of food from scratch. Actually, she makes a lot of food, almost everything from scratch, but she admits she's making a lot of puff-puff, beignets on the weekends. And so there are 2 things. The problem, just by reading this, I can tell you what the problem is. Sugar and vegetable oil. Those 2 things combined together is horrible. I can see how her cholesterol, you have the issue. I don't know if you were in I think the very first Zoom event that we did, and we talked about vegetable oils, the dangers of it, how it affects us. And I created an ebook with the good oils that you can use. You need to look at that and then change the oil. Changing that oil would make a difference. But at this point, if you know that she is having this issue, you want to make sure to start filling her plate with leafy greens a lot. The good news is the human body has the capacity to heal. Cholesterol is lifestyle choices. It's something that can easily, your child can easily come over when you start changing things that they're eating. And I am happy, if this is something of a huge concern to you, I'm happy to work with you after this so we can really make a plan for her and put some goals that in 3 months, when you go back to the doctor, this is the marker that you want to see in 6 months, right? Bad cholesterol is it's something that can be taken care of really easily. So Dr. Iyabo, there is a question for you.
Yewande, that one is easy. Minimum 1 hour of moderate to vigorous physical activity. And I say moderate to vigorous because, well, when kids, the younger they are, they're going to run around. But some of our 14, 15, 16-year-olds, once they walk for like 2 minutes, they want to go back inside. So either brisk walking or jump roping, hopscotch, or you can go to a park and play ball or basketball, but you have to get your heart racing. So at least 60 minutes. I hope that answers your question. That's a brief one. I do want to mention about the vegetarian diet, Agatha, and I hear this a lot. A lot of my patients say they're vegetarians, but they all have high bad cholesterol, and a lot of them are obese and overweight. So I think there's this new thing about I'm vegetarian, but then they still eat a lot of bad fats and they're running into cholesterol problems. So eating meat is not completely bad. If you're eating, and this is Agatha's area, but if you're eating meat that is lean and is good meat, that hasn't been injected with antibiotics and all this crap that they feed animals these days, meat is okay. I don't eat much beef, only once in a blue moon. But it's not like it's bad, but it's worse if you're eating fried foods every day and you think it's vegetarian. So vegetarian doesn't mean you're eating healthy. This is a perfect example. And I'll send that back to Agatha. Maybe you can tell us what kind of meats are good for us.
I mean, grass-fed beef, pastured beef is good, but I don't even try. You can be vegetarian and healthy. I don't try to sway people one way or the other. What I try for them to do is that they eat real food. Because as you said, a lot of vegetarians, not just the fried, like now you see they are the fake meats that they put with grains and beans and all these things. You need to the moment you look at the label is when you realize that there is no way I can strive fully on something like this, because the concoctions of these cheap oils and like something like pea protein that's been so denatured, you can't even tell what it was before just by looking at the powder. There is no way that your body can recognize it. So if you want to be a vegetarian, then invest a little bit of time to get real food that has protein. Whether you're doing quinoa, you're doing a little bit of quinoa, and you're doing a little bit of beans, and you're doing a little bit of brown rice, and then you're doing a lot of spinach. And when you're doing all these different vegetables, some vegetables, you need good quality fat for your body to be able to digest and absorb the nutrients. So you have to also make sure that you're using good quality olive oil. You're doing enough avocados, right? These are the things. So as a vegetarian, you can strive. But again, you're not a vegetarian because you're not eating meat. Your body needs protein. So if you are a vegetarian, figuring out how you are going to get a good source of protein that's healthy, that your body can digest, it's key. And if you can't do all that, I would say eat some fish and eat some meat. Because again, as Dr. Iyabo said, she sees these patients. She sees people come in and they are vegetarian, but they are so unhealthy because of all these things that we just touched on. Every time somebody tells me they are eating healthy, but they have issues, the first question I would ask is what oils? People don't realize how dangerous these vegetable oils are to the human body. It's a chemical that our body can process. Let's see, I think we have. So Bolaji asked, how can we, if you go to my IG page and click on the link in my bio, there is the ebook. You can download it. There is a free ebook that you can download.
And I just want to mention again on cholesterol, we have to remember there are some forms of genetic high cholesterol tendencies in families. I actually see quite a bit of those because the parents wonder, they're like, and that's why now we test cholesterol on all kids from 12 and above at their health checks, because there's some kids who are skinny, they're normal weight, but they have high cholesterol. And if you test all the family members, everybody else has high cholesterol. So there's a genetic kind of inherited, what we call hypercholesterolemia. And that's why it's so important to eat healthy, to be careful of what you eat, because everybody thinks you have to be obese or overweight, and that means you have high cholesterol. You could be skinny and slim, and you have high cholesterol. And that's why you have to go to your doctor's checkups. If you're going for checkups, preventive care is the most important. What Agatha and I are doing today is preventive care. And going to your primary care doctor is preventive care. Don't wait until you're sick. There's many ways you can prevent being sick. And we didn't even give, Agatha, I forgot to do this. We have to give a disclaimer that none of what we're saying today replaces going to see your doctor. Even though I'm a physician, this is not a doctor consultation. So please, if you're feeling ill or you don't feel well, please go and see your doctor. This is not a physician consultation.
That's right. And you know, it's so funny. You said, when you said it's not cholesterol, it's not a weight issue. The thing, a lot of the kids here, they won't remember, but I know the parents would. I always would talk about David Letterman. David Letterman was the skinniest person on TV, but he almost died from high cholesterol. He had a bypass. It's not a size thing. It's how you eat. And so we have 5 more minutes. Who is going to volunteer when we're done to pray? And it has to be a kid. Who is going to volunteer to pray for us? Let me go on the next screen. That way I make sure I'm seeing everybody. Well, you guys, don't put all your hands up at once. When you volunteer, you can unmute yourself. So you can, before somebody prays, Dr. Iyabo, anything you want to add? When they pray, then I would close. But is there anything you want to add?
Our kids are watching us. Our kids will do what we do and not necessarily what we say. So if you're eating unhealthy and eating all these things we're saying, they're not good for you, and you're telling your kids to go and eat the spinach, they won't do it. So practice what you preach.
That's right. That's right. I can't stress that enough, that practice what you preach. And as parents, we have a responsibility to help our children make the right decisions. Sometimes you as an adult know that 10 cans of Coke might be something bad. Your child doesn't know. So when your child is asking, sometimes I know it's hard because life gets in the way. There is just so much we have going on. But you have to consistently say no to the things that you know in your gut is going to make them sick because you have been there or because someone you know have already experienced it. Bad eating habit never hides. And it's not because just of size. Down the road, you can, when your child is 30 and you're alive, you can look and like, oh my gosh, this is from that thing. Because it never hides. It one way or the other is going to rise up. It's going to come up. So let's try our best. And for children, no matter how much your parents love you, they can't, when you're sick, they can't be sick for you. You would have to walk that journey yourself as much as they love you. but you have an opportunity today going forward to really start making decisions based on your future health, to go, oh, yeah, you guys are eating McDonald's. I'm not going to do McDonald's today. It might be I'll do McDonald's one time in a month or once a year, or I won't eat McDonald's at all. I'm not going to drink soda because I want to be healthy. I don't want to be sick. You have that power. Your body, like any machine, the thing that just comes into my mind to try and describe this, you have your parents have a beautiful car. You never see your parent put water in the car because water is cheap. They've put the gas, what that car needs for it to run. The moment they put water in that car is damaged. You should start looking at your body. It's not just that. This is the only body you have, this physical body. The moment you're putting the wrong things in, it accumulates, and one day it's just going to go past, because it's a machine. It's the reason why you wake up and put your leg down, it works by itself, you breathe, all these things. The human body, it's an intricate machine. All it wants for us is to treat it well. That's it. So who is praying? If not, I'm going to ask Evelyn to pray. Evelyn, you can unmute and pray for us if nobody's praying. I just unmuted you. Can you unmute yourself? Yeah. We can't hear you. Well, we can't hear you. Let somebody else. Faith, I can see. Oh, baby Abby. Abby, can you pray? Oh, somebody's praying already? Sophia, are you praying? Oh, okay. My screen is so small, so I have to scroll. I can't see everybody on my screen. I can only see, I think, 15 on my screen. Who is going to pray? Soledad prayed earlier. She did a wonderful job. Who else is going to pray? That we can hear. Curtis, go. Unmute.
Would you like Julia or Sophia too?
Yes. Julia, Sophia, you guys pray for us. Thank you. Julia, pray.
Please.
Thank you, Lord, for this beautiful day that you have given us. Thank you for all the wonderful things that you have put into our life. And please keep everyone safe that is in this world. Please let everything that's happening calm down. And please let us all be safe and keep everyone in this world safe, even the homeless, even the people who have done bad. Thank you for taking away our sins, and thank you for doing all that you have done for us. Amen.
Amen, Julia. Thank you. Thank you so much. That was very nice. So,
this was
Dr.
Great. Thank you so much.
Thank you. Thank you, Dr. Iyabo. And you guys, please follow Dr. Iyabo on social media. Subscribe to her newsletter. Follow me. Subscribe to the newsletter. That way, when we plan an event, you can all see when it's coming up. But again, our hope was that we ignite in you that, oh, these sicknesses, there is an immediate solution to it. Like, this doesn't have to be, even if this was you as an adult, this is the thing that you've been resigned to, you can change it for your children. Sickness is not as common as it is, it's not so common. You can avoid being sick. But thank you guys so much for making the time. And Dr. Iyabo, you can close with anything you want.
Yes, thank you, everybody. I hope this was helpful. Little steps, like my friend on Women of Change, the name of her book is Tiny Steps Lead to Big Things. So just make small steps every day. You don't have to overwhelm yourself with everything we said. Maybe today, go out and play for 1 hour with the kids. Maybe tomorrow, change something else. So just tiny, tiny little steps will lead to big things. But that's all for now. Thank you so much. Enjoy the rest of your weekend. Bye, everyone. We love you all.
Thank you.
Bye-bye.
Bye. Bye, guys.
Thank you. Thank you very much.
You're welcome.